I'm sorry?
I was going to print this out and okay.
Yeah.
All right, and since we've got 4 board members present, I'm gonna go ahead and call the meeting to order. If we could just review the agenda, does anyone would like to change the order? Agenda? All right, and everyone should have, thank you. Everyone should have the meetings from the August Board of Health meeting.
I move we approve the August 11th minutes.
Can I get a second?
I second.
Thank you, Ann. Thank you, Ann. All those in favor, say aye.
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 All right, that's 4 votes for aye. Thank you very much. Is there anyone from the public on the line that could make a comment or that would want to make a comment?
Or here.
There is online.
But there is somebody.
There's somebody else. Okay. All right, well, in that case, unfinished business. Gino typically reports out on that. He's not present today. Will anybody reporting out on that?
I'm not sure about the social worker update.
So we have not hired anyone or entered any. There have been no new candidates.
No new candidates. Okay. All right. Thank you.
And that where do we stand with sanitarium?
I was going to give that in my update, but yeah, we still do not have. There weren't any new candidates on the latest list that I got, and there were no responses from the 3. So those lists are just the state keeps the list for like 6 months of eligible candidates. So I'm assuming that most of them have found jobs already because there's been no response. So it's going to have to be re-advertised again. I need another sanitarian on staff.
I think I saw a Facebook post. I thought I saw a Facebook post asking, looking for the sanitarian recently.
Yes.
Okay. All right. Thank you for that. All right, Charlie, want to run us through the finances?
Yeah, absolutely. Good morning, everyone. And I would like to introduce Amber Taylor. She is a senior accountant at our firm, and she helps with your work as well, in addition to me. I thought it'd be nice to have her here and you can get to know her. And then if I happen to be out 1 month, she can sit in.
Welcome, Amber.
Yeah, welcome. It's nice to have you.
So good morning. Go over the July 31st, 2023 key metrics. Bank balance as of July 31st is $620,000. That's in excess of our reserve requirements by approximately $260,000. As far as your revenue and expenditures, revenue for the month of July, this is also year to date because we're in a new fiscal year, is $137,000. We're going to reduce that by salaries and wages of $95,000 and operating expenses of $21,000, leaving us a surplus for the month of July and year to date as of $20,264. Accounts receivable sit at $288,000. Of that, $244 belongs to West Virginia Treasury. That's 85% of your AR balance, and we will see in August that go down. Everything else is less than 10% of your total receivable balance. And then in comparison to last year, we're at a surplus of $20,000. As of the end of July last year, we were at a deficit, and I believe it was $60,000. So, yes. So we're off to a much better year so far. Any questions on the July financials?
I move we accept the July financials as prepared.
I second.
I second.
Thank you, Ann. All those in favor say aye.
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 Aye. Motion passes. The July 2023 financial reports are adopted.
All right, August 31st, these are your preliminary for August. We have a bank balance of $618,000. That's in compliance with reserve requirements in excess of $254,000. The financial summary for August alone, we had revenue of $70,000. We're gonna reduce that by salaries and wages of $103,000 and operating expenses of approximately $9,000, leaving us a deficit for the month of August of $42,000. Fiscal year to date, so this would be July and August, and we're about 17% of the way through the year. We have revenue of $207,000. We're gonna reduce that by salaries and wages of $199,000 and operating expenditures of $30,000, leaving us a deficit for the fiscal year to date of $22,000. As far as revenue, we are 3% below what we budgeted. For salaries and wages, we're in line, and operating expenditures were below budget by 6%. If we're comparing to last year, we're right in line where we were last year this time. Accounts receivable.
Yeah, well, what accounts for the month-to-month increase in wages?
Excuse me?
What accounts for the there's an approximately 9% increase in wages paid? What August over July?
The number of
The
weeks. in the
salaries
month.
and wages.
Yeah.
Like 95.
The number of weeks. in the
Okay,
month.
sorry, so these are preliminary reports. There may be, I think that retirement might be in there twice, and we do need to remove that.
Okay.
So that would be about 9,000.
Right. There's I was just wondering what it, I mean, I'm sure it's legitimate. I just don't know. I just want to know what it was.
Yeah, salaries and wages were a little higher for the month. The reason why I'm not sure, did you highlight that? Yeah, it's preliminary. But I can look at that and get it back to
We
you.
actually did hire
Okay.
peer recovery coaches.
Oh, okay. So, as far as what we entered, salaries and wages were a little higher in August than in July. And Dr. Reedy just pointed out that there was a new hire, but it is preliminary. So I'll take a look, make sure there's nothing stuck in there that shouldn't be.
Okay.
The new
Great.
hires, the peer recovery coaches, that will be totally grant funded, but that's when the grant pays us quarterly after we submit expenses. So
Right.
So that difference should be completely covered by grant money.
No, I'm sure it's not a big concern. I just want to know, I'm just curious when I see an increase like that. Just curious as to what it is.
Yep, that's a great question, Elliot. Thank you very much.
Sure.
Any other questions on the financial summary? Or about what we just talked about?
No,
Okay.
I'm here. Thank you.
Accounts receivable, we set at $253,000. Of that, 176 is West Virginia Treasury. So that did go down about $68,000 from last month.
Mm.
And the rest is just less than they're small amounts.
Mm.
And that would be the end of August, unless if there's any questions.
Thank you.
Great. Thank you.
Yeah, no question. Thank you. Right, the agency activity report.
So the environmental activity report, we did change up the report a little bit to really only include the things that are more relevant. Some of the things on there just weren't, it was just too many numbers, so we cleaned up the report a little bit. So the food inspections last month, There were 29 routine of regular food establishments. They also had 26 temporary food vendor inspections last month with the fair and several other events. And the other numbers are pretty much in line with what we've been doing for septic work, and that's about it. And I already told you that a couple of us went to a conference last month and spoke at that conference. And then one of my sanitarians also took an epi-ready training this a couple weeks ago. So
What is that,
epidemiology ready training. So there was a good food safety component into it. Bevan went to the training as well. So
Yeah, it was mainly going over how to respond to like potential foodborne outbreaks. So it kind of went over the epidemiology side, but it also went over like the environmental side as well, such as like restaurant investigations and things of that nature.
any questions?
Thank you. Preparedness.
So on Wednesday, we went out to Hampshire County. It was like Hope Church in Augusta, and we participated in an EPA sponsored functional exercise. And that exercise was based off of terrorist group attacking utilities and electrical lines across all counties in the Eastern Panhandle. And while we had some components to it, it was more geared towards emergency management, the utilities and that sort of thing. But it was fun to participate with it.
May I ask you a question about that? I was invited to go to that, and I've been trying to attend a lot of these emergency hearings and things or trainings. And I was really sorry to have missed that. I was trying to work it out, but I had something going on that day and I wouldn't be back in time. I was getting emails from Steve Allen, I was on the group, that we weren't having very many people from Jefferson County at the point that I was noticing that we weren't having very much response. Do you know if we had a better turnout than was anticipated?
We had, so the first, this exercise series, we had the tabletop, and the tabletop exercise was at the Ranson Civic Center.
Right, I was there.
And we had like a tremendous participation for that one.
Right, I was there for that, but the one in Hampshire.
The one in Hampshire County, we didn't have as much participation. We only.
That's
So
disappointing.
law enforcement and EMS typically have difficulty with schedules of scheduling people to go out of town because it's somewhat easier to do one that's local or in the next county over. Certainly. Because then they can respond if they're needed.
Very true.
If they're more than
So this was definitely a drive.
And so this is and so the ones we have here, places like Mineral County won't be as well represented.
Right.
But we did have other agencies, the nursing homes came, hospice came. We had 5 people from
and they were able to contact the sheriff's office because the point of a functional exercise is you're supposed to actually like make the phone calls as you would if it were a real emergency.
Yeah.
With of course the understanding that when you call these people, you first say this is an exercise, otherwise you're creating some panic.
I was very sorry to have missed it.
So they called the sheriff's office, who networked with Homeland Security. They called Army Corps of Engineers in Baltimore. So they actually made these calls, and the person they got, was aware this was going on.
Right.
But it's a good exercise because we don't do it every day.
Right. It's necessary. Unfortunately, it's something we must do these days. But I'm very sorry to have missed that. I really was trying to work that out.
And I think there are plans in the works for a full-scale exercise, and that's a step up where you actually put boots on the ground and actually do.
That'd be interesting.
And just for us as an agency, saying what's our role in it? Well, an important thing, if there's a power outage for even a few hours and food spoils at home or restaurants or or grocery stores, that becomes a real problem because, you know, so if the grocery stores have to throw out all their food, or anyone has to throw out all their food in their food establishments, then they have to be re-inspected. Is that right, Gillian? They have
Well,
to,
yeah,
what
we have to
happens?
make sure that the refrigeration
Yeah.
is back up.
And that's how many licensed?
There's quite a few.
Yeah, several hundred.
Wow.
Yeah, 400.
Yeah, so this would be, you know, if we have power outage across the county, or even a significant part of the county for a day or two, from a food standpoint, that's a really serious issue.
Okay.
As well as water, because the pumping stations may not work, individual wells won't work. So people say, where am I going to get fresh water? So
Yeah.
so these get really complicated, and it's the first 72 hours of a disaster, you need to think of you're on your own.
Yep. Yep. And there's a lot of movement these days about self-sufficiency, being able to rely on yourself and your neighbors, your community. That's true. Very true. Very important.
And so the plans are called all hazard plans, meaning you're not just thinking about tornadoes or hurricanes. You
Right.
say, what can you imagine happening?
Yeah. Well,
Use your imagination.
unfortunately, these terrorist things are on our minds these days. They should be. Thank you. I appreciate that.
You're welcome.
I'm sorry
Thank
I
you.
missed it.
Clinical activity report.
So I think you have the report. So the in the preceding month, family planning were up to 25 encounters, and the breast and cervical cancer screening program. We do not see too many people for that, largely because people now can have Medicaid and other insurances. So 15 years ago, when there were more uninsured, this was a safety net program that would, but there's still a lot of people that do not have insurance, do not get the testing. Sexually transmitted infections, we continue to see people, anyone who's concerned they can have a sexually transmitted infection, you know, can come in here, get evaluated and tested, and it is covered by our funding. And then childhood vaccinations, quite a few in the preschool rush, and the nurses were, as you can see, pretty busy. Flu shots we do not give during the summer, but we have them on board, so we will be giving them now in September. You can just call up and get scheduled. And the COVID vaccines, we no longer have any in stock, and that's true of most places because the prior vaccine is no longer what's going to be used going forward. The newer vaccine is not yet authorized because the data on how beneficial it is isn't there because it's newer. These studies are ongoing. One of the reasons it's going to be maybe a little longer in getting authorization is that if you have, like initially with COVID, lots of people were getting seriously ill or dying. And now with not many people getting seriously ill or dying, the group that doesn't get it's still looking pretty good, which is a great thing. But it's going to take more numbers to see if there's a real difference or a longer time. So that's you know, every so often on the news something will pop up about, oh, it's coming. We'll wait and see.
So regarding the COVID vaccines, do you do reports to VAERS, or do people just automatically report vaccine adverse?
So
events?
anybody can report a medication adverse event to the MedWatch or VAERS, which is the program.
Yeah.
But there are certain ones that we are required to report, and fortunately, we've seen. I think I've had maybe 3 that rose to the level of required to report. that doesn't mean that there's actually cause, but if certain events happen, we report that. So that's, you know, and gathering the data. Things like I have a sore arm afterwards, we don't report that. That's
Right.
not a serious adverse
Yeah,
event.
that's.
A person could report it. And so that.
Okay, well, that was something I was curious about. I appreciate that.
And that's the same with other vaccines as well. If someone calls and says they have an issue, we're to report that.
Right.
Yeah.
I just didn't know if the proper course is they call you and you call theirs, or if they just automatically reach out to.
So if they call us and report a problem, so if someone calls us the next morning and says, I feel achy, and the nurse talks to them, just like after a childhood vaccine, and discusses whether it sounds like it's within the normal types of side effects people get or not. If it's something uncommon, then or serious, anything requiring hospitalization, things like that.
What about long term? I know that a lot of the problems that are having from the COVID vaccine are longer term issues where I think it was just recently Megyn Kelly, television personality, has come out saying now she has these autoimmune issues that have been reported by many others who have received it. And I'm just curious to know, do we pay attention to any long-term things like that are cropping up?
So determining cause and effect is something we would not be able to do.
Okay.
And even the CDC and universities may not be able to determine it, because a lot of these illnesses are happening even prior to COVID and prior to the vaccine. So whether there's a higher number than there would have been expected. And so if I were to have something bad happen to me, it's possible my prior shots did it, or it's possible other things, and it may not be. So that can become controversial. That's hard to know. So
I guess we could have a discussion at a later time. I don't mean to tie up all the time here, but there are a lot of people who are experiencing complications, the same type of complications after receiving the same type of vaccine that they're starting to kind of put together now. And I'm just curious to know if as a county, do we pay attention to that, or are there any people?
We would not be able to determine if their complication was from the vaccine or everything else in their life.
Okay.
So there are a set of serious adverse reactions that we are required to report. The long-term COVID, long-term difficulties after vaccine, it's hard to know if someone feels tired a year after their vaccine or the year after COVID. Is that due to COVID, or is it the vaccine? Or is it that you could be tired anyway?
I appreciate that. This isn't a tired thing. That I think her issue, and apparently a number of other people, they're reporting autoimmune issues that they're thinking are related. And I was just wondering, I don't mean to take up all the time here. I was just curious to know, do we as a county pay attention, or not maybe pay attention, but report these things, keep track of these things? If we do not, that's just fine. I was just curious.
No.
Well, I've heard it's just to follow up on the reporting aspect. The Brownstone Institute recently published an article that said that the CDC has, in its words, quietly stopped accepting adverse events reports on COVID vaccines. Have you heard anything about that, Dr. Reedy?
I've not heard that, but it's the FDA that we report to, which is a separate federal agency.
So
the-
what is the V-Safe program then that the CDC has?
Which program? I'm sorry.
V-Safe, V-safe.
V-Safe. The V-Safe is that right after the vaccination, people will get text. You can put it on your phone, and you can text how you feel, and other things. So it's different than the VAERS. So it gets more information and an easier way for people to contact, but it's a different accessibility that's
Yeah, it says that one was developed
it's
specifically
not
for
one.
COVID.
Yeah.
And
It's for COVID. It's not one we report to. It's for individuals to be able to, on their cell phone.
Oh, I see. Oh, okay.
Probably be discontinued. That's
Right. And to your point, Doctor, I understand that you or we or the Board of Health of Jefferson County cannot make a determination as to whether or not the adverse effect or complaint by the recipient of the vaccine is related to the vaccine. But the body of work in terms of studies that is coming out now, you know, because over time, there are different individuals and organizations that do analyses of the data, and the data is not looking good in terms of the safety of these vaccines. Any comment on that?
well, since safety of the vaccines isn't specifically an agenda item, I won't spend a long time going into this, but there are a lot of conflicting reports, and the conclusions of reports are not always what's supported by the data. The data may, and this doesn't matter who's putting out the reports, needs to be looked at in great detail about the accuracy and the methodology. If there's no benefit from any medical intervention for anything, there's no need, even if there's no harm. If there's harm, then the benefit needs to be pretty clear. I'm not aware of new studies showing significant information that we didn't know 2 years ago about the side effects of the COVID vaccines. I've heard lots of allegations, and when I look at it, those are opinions with no data supporting it, or data is 3 people reported a case of something. But even rare diseases we see all the time. So it's hard to know.
Right. I mean, there's a difference between anecdotal evidence and statistical analysis. And the statistical analysis that is being done now through actuarial tables and through Medicare and Medicaid data is not looking good. So, you know, that's my opinion. I was just wondering what yours was.
I believe you shared it. I believe you shared it already, Dr. Reedy. Thank you, Elliot. Elliot, I'd be interested in that Brownstone article that you mentioned about CDC not taking that report. I find it interesting that we're reporting the VAERS through FDA. But I'm familiar with Brownstone Institute. I'd love to see that report if you'd be willing to share it.
Yeah, so if this is the V-Safe, that's a different.
I'd be happy to.
Yeah,
yeah, it does say, like, if you just search V-Safe, it says that on May 19th, 2023, CDC closed enrollment in V-Safe for COVID-19, but people are still able to report any possible health problems or adverse events following vaccination to VAERS.
So maybe that's what Brownstone was talking about, is the V-Safe versus VAERS. Is that possible, Elliot?
It's possible. Mentioned specifically
that would make sense.
Program. Yeah.
Okay.
Thank you for
I'll send it to you.
That took us.
Yeah. All right.
All right. Epidemiology report.
Oh,
Thank
okay.
you.
So currently there are 3 respiratory pathogens that we're going to be focusing on today. The first one being influenza. Flu viruses typically circulate during the fall and winter months, during what's kind of known traditionally as the flu season. The exact timing and duration of the flu season varies, but flu activity often begins to increase around October, November. Obviously, we're kind of approaching that, so that's something to kind of be cautious of. Currently, we're not seeing very many cases of flu, but this is to be expected. Flu doesn't normally pick up until around October. With COVID, we know from social contacts as well as other reports we've received that COVID is still prevalent within the community. Hospitalizations are still low, and there hasn't really been a great increase in that. The next one is RSV. RSV possesses the biggest threat to children under 5. And adults over the age of 65. There are sporadic cases year round, but seasonal increases in the fall and winter months are expected. The next portion we're kind of focusing on is the enteric diseases. That's kind of what's most prevalent right now that I'm seeing. Just to kind of retouch on what we've talked about previously, is enteric diseases are caused by microorganisms such as viruses, bacteria, and parasites that cause intestinal illness. So that's kind of more GI symptoms that you would find linked to these. These diseases are most frequently result from consuming contaminated food, water, and can spread from person to person as well. Some of the main ones we've been seeing over the last several months have been Campylobacter, Salmonella, Cryptosporidium, and sugar toxin producing E. coli. Most cases of foodborne illness can be prevented with proper cooking, processing of food to destroy pathogens, and careful attention to hand washing and cross-contamination. And that's my report today.
Thank you. Health officer report?
Not a lot of new activities in the last month. We are gearing up on the opioid response. And the grant request for this grant cycle for this year starts September 1st. You've heard before that processing these grants is tedious and often delayed. So the information for us to request the grant, we received August 31st evening. That's when the state received it. And we have to submit the report online by 2 weeks later, by next Friday. Fortunately, much of this we've been doing and we thought about, but it's still, you got to add up all the numbers and each year the program will be a little different. We do expect that this will be approved statewide more quickly than in the past. They are better staffed than they were, but we will not have approval of it probably for a few months yet. But we will continue to offer the services with full expectation that the grant will be there and we'll get reimbursed. But it's one of these little anxieties that we always have. There are 2 events next week that'll be community-wide, and actually one of them is called the Save a Life Day, is a state and multi-state wide across Appalachia of naloxone distribution, and you'll see more about that, and we'll have it on our website. That there will be several places. Our staff will be at the Jefferson Community Ministries providing naloxone training and distribution. There'll be other areas within the county and in Berkeley County. And then next Friday evening at Asbury Methodist Church in Charlestown, not the one in Shepherdstown, in Charlestown, that evening at 6 o'clock, there's an event called Loving Our Community, which is different vendors, including the health department, will be there providing some services, especially an outreach to people who could be involved with substance use. But that's one that other organizations have started this summer, and they've had 2 or 3 of them in Berkeley County, one here 2 months ago. So every other month it's going to be in Jefferson County.
Dr. Reedy, would you please repeat when Save a Life Day is again?
Save a Life Day is the
It's next
14th.
Thursday or?
Yes, Thursday.
It's September 14th.
Thank you very much.
There's information about it in the spirit from this.
Okay, I will check. Thank you very much.
And you did remind me, I forgot to mention that we're also going to be applying for a radon grant for next year, so.
Good.
Yeah.
What do you do with the radon grant?
So it's a grant, I think it's a federal grant that the state has monies for, and we apply through the state, and I think it's about $20,000 that we can be awarded. And we can use that money to purchase radon test kits to distribute throughout the community and just to provide more education on radon.
Okay, thank you.
And this is an area that has high radon levels from just because of our type of rock. That's all I have.
Are there any updates on the office-based medication?
So we have to submit, we'll have to submit a several part grant for that. And one of the first determinations is whether we also need to become a licensed mental health center. If that is also required, that may be a bar too high. That's a huge undertaking. One person we spoke to thought that that's what we'd have to do also, which so this will probably, take another month or two.
To kind of figure out whether it's feasible or not. Is that what you mean?
Right. So the regulatory requirements for a licensed mental health center, behavioral health center, are quite a bit more. It's almost the same amount of administrative support you need with a hospital and all that, with different all sorts of committees and so that's we'll see if that's possible. That's hard to do when you only have a few staff members.
Okay.
But we'll keep you apprised of that. Another issue as far as grant writing is the family planning program. It's a CDC program that provides family planning services for low-income people. That's been provided yearly through the state. It will still be so CDC money comes through the state and is applied with the whole program set up. This year, starting next spring, it's going to change in that we will have to apply for it with a grant, and not everyone who applies is going to get it. And we're going to then need to be responsible for asking how much money we want, and they'll tell us the maximum and show them what we're going to be purchasing. So no longer will we get supplies from the state. We will have to purchase all that from vendors, just like a private office would. Same with medications. So it adds another level of complexity, both in writing it and administering it, but it's still an important program for a segment of the population. It does not pay well, and so almost nobody will participate with it. This health departments and federally qualified health centers.
Would you mind explaining to me what is a family planning program?
So the family planning program involves someone that comes in and often they're interested in what we call birth control. Often they're coming for counseling, and so the family planning program has very involved things that of things we have to discuss: abstinence, misunderstanding, not just of youth, adolescents, but even adults on conception. Is how do you get pregnant? You know, it's a,
Mhm.
people don't necessarily get that from their parents or their church or their school. They don't get the facts, and their primary practitioner also may not be comfortable talking about it. So you often need people that specialize in this, and so it's trying to, so this typically isn't people needing fertility advice, although that can be, that's part of family planning. If someone's having difficulties, they would then be, you know, probably referred to more of a specialist. But this often involves you know, talking about condom use and different types, distributing condoms, and then talking about other pharmacology methods, whether it's birth control pills or injectable things like brand name Provera, or some implantable longer acting for some people. Taking a pill daily is just not something they're equipped to do at that point in their life. So it's trying to help people delay getting pregnant until they're ready for it. You know, obviously, if you can just not have sex, you won't get pregnant, but that does not always,
100% of the time.
humans are not always able to do that 100% of the time. So it's and so this is in the privacy of that office.
Isn't this statutorily required that we provide those services by the state?
I believe it is.
I'm pretty sure it is.
Consent code.
Okay. So we don't do anything here related to abortion or anything like that?
We do not do abortions. We don't advise people to get abortions or anything like that.
Okay, and you can't or don't prescribe abortion medications or anything like that? Okay. Okay.
The and you know, most of the practitioners I know of who are involved, midwives or whoever, are really not interested in abortions. They're interested in preventing pregnancy. And
well, do you also discuss adoption as an option for people who might come in worried about?
So another thing we'll do is we do pregnancy tests when people come in, and and then we get certain information and do, you know, confirmatory testing. But the so as far as you know, we don't get into, and I'd have to ask the nurses because they do it. We don't specifically talk about if you get pregnant, who would raise the child. That's
well, I just mean suggesting adoption as, you know, an option with an unplanned pregnancy. That's all. I mean, I hope that you would.
Well, I'm not sure when people are coming and saying they do not want to get pregnant. As far as choices when someone is pregnant,
yes,
then that obviously is a major piece.
Yes, sir, certainly. So, you know, there are places in the area that can help women who are scared if they need help. I do hope that you direct them, you know, as an option.
So when someone is pregnant, we try and get them in to see someone who takes care of pregnancies, an obstetrician, midwife, someone like that, because getting early prenatal care is very important.
Of course.
So we work on that. As far as the specifics of the counseling, I do not know that, but that would be a separate piece than the prevention of pregnancy.
Well, yes, certainly it would be, but if you offer pregnancy testing, you know, if somebody can't go out and do their own pregnancy test and they come to you for help, I wonder if they might.
Well, they often come from confirmatory testing.
Okay.
And,
I would just do a second pregnancy test, but okay.
Well, there's some people don't have and so these are not always people have great social network,
Sure.
great supportive. network.
Right, and that's why I suggest places in the community that are there to help women who are afraid and unsure, and just, you know, there are other options to abortion is my only point. And I was just hoping that you as a group here, maybe the nurses or, you know,
So,
would be able to suggest it. That's all.
so they discuss the options.
Okay,
You know, but, and we do have a list of the, you know, the different providers in the
good.
area, which includes, of course, surrounding counties,
course.
because that's how people get medical care here.
Certainly.
You know,
Yep, I know I have to go to Virginia to get my OB/GYN care, yeah. Well, thank you, I appreciate you answering my questions.
Thank you. Health Administrator report, typically be Gino.
So Gino's not here. He asked him if there was anything specific to discuss, and he said no. So working on, I think the audit is scheduled for next month. I believe, that's scheduled.
Well, that concludes the agenda for the September Board of Health meeting.
I move we adjourn.
A second. All those in favor, say aye.
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 We don't have anybody there.
Ann said aye. Thank you, Ann. We got it.
Goodbye.
Bye-bye. Have a good day, everyone. Thank you.
You have a record meeting.
Our meeting's today.
Second bar.
Always, always.